Hi guys, this is your module on maintaining a sterile field and opening a dressing tray. Maintaining a sterile field is vital to maintaining asepsis. Your dressing kit is a sterile kit. You can use it as a sterile field, and your drip can also be used as a sterile field. To prepare for doing your dressing, you need to know what are your orders. What are you going to find? What are you expecting to find when you go into that dressing? What are you expecting you will need to do that dressing? Has the patient received pain medication recently? Can you offer them pain medication before or after? These are things that are necessary for you to start your process. Now, after speaking with your patient and determining the need for any kind of pain medication, their level of comfort, explaining the procedure and what might happen to them, you are going to go to the slush room and get yourself prepared. In the hospitals in Belize, we typically have some silver tables with wheels on them, and those are the ones that you would find large enough, much larger, about twice the size of what I have here, that we use for doing dressings. So if you're in your slush room, what you would need to do is to be sure to wipe down your tray with a healthy dose of cetramide or whatever cleaning solution is used at your institution. After you've done that, you can prepare yourself with all the equipment that you will need to do your dressing. Typically, for dressings, we would need a dressing tray, extra gauze, tape or bandages, your sterile and unsterile gloves, and whatever solutions are required for your dressing. When you have your sterile tray, you are going to pay attention to the drape that it's wrapped in. It's a double layered system where they have one drape on the outside, typically these blue, gray, or green colors, and another drape on the inside. The one on the outside should be inspected to see if it's dry, if it's torn, is the tape on it intact, does the tape have these black lines? The black lines indicate that the package has passed through the process of sterilization. Note the name of the tray. Each tray includes a certain content that is required for doing the procedure that's listed on it. In this case, we have this one labeled a suture tray, but I've put a few bowls and some gauze and some Kellys and forceps in there. You also want to note the dates. The first is the date which the process has been done, where it's been sterilized. The second is the expiry date. You do not want to use a tray beyond its expiry date. So, we work on opening our tray. You remove the tape from the tray. And then you work on opening your tray with both hands. You're going to take it and put it away from you. You work out and you make sure you handle it with both hands so that you can be sure to avoid cross-contamination. Now, our table is this size, which means that a 1-inch layer on the outside is considered unsterile. We want to be sure to keep everything inside that imaginary barrier. Only sterile items go on your sterile field. Your sterile field occurs about the level of your waist. Anything below the level of your waist is considered unsterile. You position yourself, in my case, on the right side of the patient because I am right-handed. Typical medicine suggests using the right side. However, it's been documented that the right side is used simply because most people are right-handed. If you are left-handed and that presents you an issue, then you would like to use your left side. For me, I'm right dominant, so my right hand needs to control most of my actions. So my patient needs to be on that side. You do not turn your back to your sterile field. Once you have turned your attention away from your field is no longer sterile because you have turned away from it. You have had a portion of time when you are not paying attention to that field. If you are assisting and you are not sterile, you do not touch anything that is sterile and you do not reach across the sterile field. So if you are assisting with the process, you are going to make sure that you open and throw everything on. You are not going to touch any of that. If you are assisting with pouring the fluids, it's the same thing. You handle the bottle with the label towards your palm, the smooth side away, open the package and pour without touching anything. If you do not have an assistant, you would like to make sure that you have 2 pairs of sterile gloves. With 2 pairs of sterile gloves, you will don the first to open up the package, separate the bowls, and then you will have to make contact with the bottles. So, making contact with that bottle then makes you unsterile, which means then that you are going to have to touch the bottle, pour, doff the gloves, and don new gloves. If that is the case, it's the perfect time to pour your solution. After you've poured your solution, you go and remove your dressing with your unsterile glove, and then you can put new gloves on in order to make contact with the tray once more. In order to do this process, you need to pay attention to our video on donning and doffing gloves, which is in the link below, and washing your hands, also in the link below. So that's it for our session on maintaining a sterile field and opening your sterile tray.